Dr. Nuako, tell us how you became a doctor, why you became a doctor, how long are you a doctor, and why did you settle where you settled, and also, the type of specific illnesses which you more or less address, since no doctor can address all illnesses. Tell us about it.
Yes, I'm presently a gastroenterologist, which is a stomach doctor. I trained in Ghana, which is in West Africa, and I graduated in 1985. I moved to America and trained in Baltimore and subsequently at the Mayo Clinic in Rochester, Minnesota, doing my fellowship in gastroenterology. I chose gastroenterology because most of the really smart doctors that I admired while I was training were in that field. And I found that it was a good combination of surgery and medicine. It's one of the crossover fields. Very interesting, always growing, and very stimulating. And I'm very glad that I chose this field. Presently,
I can, sorry to interrupt you. I can, of course, you know how they say love goes through the stomach. And if love goes through the stomach, there must be more going through. In fact, I have very often heard from other doctors and saying that almost every major illness actually, forget accidents and certain things, but starts in the stomach in some shape and form, one way or the other way. So I can see why this is an important part of the body. So go on, sorry for interrupting you.
No, that's very true. And, our field is fast evolving and we have so many different subspecialties within gastroenterology. And I think this is what has kept it very fascinating. So I'm proud to work in rural West Tennessee. I live in a great community and I've made lots of friends since I came here in 1999. This is my 20th anniversary of practicing in this area. And I've been welcomed and established my home here. So I'm very happy and proud to be a member of this community and to serve the people here.
And, they need their stomach kept clean. I actually do know your country. I have worked 2 years in Dogo.
Okay.
Yeah.
That's nice.
That was in 1979.
Oh, my, that's a long time ago.
Before you were born.
Oh, no.
All right, doctor. Anything else you would like to, add to this? Why you're doing this, and this what you, because I know you also indulge in weight loss or weight management, as you call it. So, how do you spread out still from there? What else you do?
Yes, I practice gastroenterology, and I got a lot of referrals of patients with fatty liver. By the time they would come, these often would be 70-year-old women who would come with end-stage liver disease, and I realized they never knew what was going to happen. And some of the people I really got to enjoy, and they would just die because unfortunately they were too old to get liver transplant. And so I realized that the only way I can help them is to prevent the condition. And the only way I can prevent it is to make them not get to the weight level that causes damage to the liver. And so I tried desperately and opened this weight loss center as the therapy that I can give to the patients. As that's about the best I can do, is to help them lose weight and keep their weight off to help prevent the ultimate liver damage that they can get. So, I think, it's really depressing, when you meet patients you like and you have nothing to offer. So yeah, that's why I did.
Well, that's for a doctor. It's depressing for everybody, of course. But, being educated and having learned and trained to help people, and then see them wither away and nothing to help, when very most likely, maybe not easy, but simple, weight, not eating too much or whatever. It's a simple thing. And so you stare and a person has to die when yet a few years earlier he could have been helped. All right, we will talk a lot about that.